Hello and welcome. Today we're diving into estrogen therapy, a topic that, let's be honest, has been surrounded by a whole lot of confusion for decades. But the science has changed. It's changed dramatically. So our goal here is simple: cut through the noise and give you the most current, clear information so you can finally understand the real story.
So let's say you're in the thick of it. The hot flashes, the night sweats, all those classic, really disruptive symptoms of menopause. You've probably heard that hormone therapy can help. But you've also heard the whispers about the risks, right? So what's true anymore? What are the actual trade-offs you're making? That's exactly what we're going to unpack.
All right, first things first, let's talk about the promise of relief. Because before we can even begin to understand the risks, we have to get why millions of women even consider this therapy. What makes it such a powerful option in the first place?
Let me be really clear here. When it comes to the most intense symptoms of menopause, the hot flashes that can stop you in your tracks, or the night sweats that just wreck your sleep, estrogen is, hands down, the single most effective treatment we have. But it's not just that. The benefits go deeper, helping with everything from vaginal health to protecting your bones. And, as we're about to see, there might even be a bonus for your heart if you get the timing right.
And look, this isn't just my opinion. This is the official consensus from major groups like the Menopause Society. The evidence is just overwhelming on this point. But as we know, relief from symptoms is only half of the story, isn't it?
So now let's flip the coin and talk about the risks. This is where all that fear and confusion really came from, mostly thanks to one gigantic study from over 20 years ago called the Women's Health Initiative, or the WHI. The headlines back then, they were terrifying, but what we understand today is so much more nuanced.
Okay, so the big concerns you hear about pretty much all fall into these buckets. But here is the single most important thing to get. These risks are not a blanket statement for everyone. They change and change dramatically depending on who you are, when you start, and what type of therapy you're on. Let's dig into that.
This right here is probably the biggest misunderstanding about hormone therapy. It's not just one thing. See, the WHI study found that the combination of estrogen plus a progestin led to a small but very real increase in breast cancer risk. But, and this is huge, for women who had a hysterectomy and took estrogen by itself, the risk didn't just go away, it actually went down. That's a complete 180, and it changes the entire conversation.
And to put that increased risk into some real perspective, let's look at the actual numbers from that WHI study. For every 10,000 women taking that combined therapy for 1 year, there were about 8 extra cases of invasive breast cancer. Now that's not zero, and it's something you have to take seriously for sure, but it does help frame the risk beyond those scary headlines. So what's the big takeaway here? It's that your risk isn't some single fixed number. It's more like a moving target that depends entirely on when you start therapy, how you take the hormones, and your own personal health profile. This is really the heart of the modern, personalized approach to menopause care.
This brings us to a really critical idea called the timing hypothesis. You can think of it like a window of opportunity. If you start hormone therapy within about 10 years of menopause, or before you hit age 60, the benefits, especially for your heart, seem to outweigh the risks. But if you wait and start later in life, that whole calculation can flip, and the risks for things like stroke can actually start to go up.
And it's not just when you start, it's also about how you take it. See, when you swallow an estrogen pill, it has to go through your liver first. That process can increase certain clotting factors in your blood, raising the risk for dangerous blood clots. But if you use a patch or a gel, the estrogen soaks right through your skin and bypasses the liver completely. That one simple difference seems to neutralize that specific clot risk, which is a total game changer for safety. And finally, there's one simple, absolutely non-negotiable rule. If you still have your uterus, taking estrogen all by itself can cause the lining of your uterus to overgrow, and that significantly increases your risk for endometrial cancer. That's why you must take it with a progestogen, like progesterone, which protects that lining. Simple as that. If you've had a hysterectomy, you don't have that risk, so you take estrogen alone.
Okay, but what if hormone therapy just isn't the right fit for you? Maybe it's because of your medical history, or maybe it's just a personal choice. It is so important to know that you are not out of options. There are other really effective, evidence-based ways to get relief. So there are actually several FDA-approved non-hormonal prescriptions. Certain antidepressants, SSRIs and SNRIs, have been shown to help cool down hot flashes. Same with a medication called gabapentin. And there's even a brand new class of drug, like fezolitinib, that works in a totally different way by targeting the brain's thermostat directly. And of course, we can't forget about non-prescription approaches.
Things like cognitive behavioral therapy can actually be super helpful for sleep and mood issues. And for those genitourinary symptoms specifically, there are great localized options. We're talking moisturizers, lubricants, or even a tiny dose of vaginal estrogen, which barely gets absorbed into the rest of your body and is considered safe for almost everyone.
So, how on earth do you put all of this information together and make a decision that's right for you? Well, it all comes down to something called shared decision-making. It's about forming a real partnership between you and your doctor.
This is the big guiding principle you'll hear from just about every medical society out there. And the idea is pretty simple. Use the lowest dose that actually works to give you relief, and only for as long as you really need it. The goal isn't to get rid of menopause forever. It's to use this as a tool to build a bridge over the most difficult parts of the transition, all while minimizing your long-term exposure.
And this is such an important clarification from the U.S. Preventative Services Task Force. This is a therapy for symptoms. It is not recommended as some kind of preventative pill to ward off things like heart disease or osteoporosis if you aren't having any symptoms. In that situation, the risks just don't justify the benefits.
So think of this as your personal checklist for having a really productive conversation with your doctor. You want to walk in ready to talk about, what are my goals here? What are my personal risks? What are all my other options? And based on all that, what's the best type and route for me? This approach turns the whole process from just getting a prescription into building a truly personalized collaborative health plan.
You know, we have moved so far beyond the simple yes or no answers of the past. Today, the choice about estrogen therapy is a personal equation. The variables are your symptoms, your health history, your age, and what you value most. The whole point of this was to equip you with the knowledge you need to be an active, confident partner in solving that equation for yourself.